without the microphone and without a script because it's gone. Again, Denise Otten. I healed my daughter of a deadly disease with diet and vitamins within 4 months after 5 years of drug treatment. And no, she did not need a liver transplant, which is what the doctors wanted to give to her. They said we'll have to put it on CellCept, and if that doesn't work, the liver transplant will be the only option. And she was 12 years old then. You cannot hear me? Okay. So, in short, I chose not to give my daughter a liver transplant or CellCept. I chose to look for an alternative answer, and I found Dr. Burt Berkson. However, he is not a pediatrician, so I couldn't bring my daughter here. And try as I might to twist his arm, his wife said, "I'm sorry, but we can't help you by doing it." She tried to guide me. The point is, I met his clients who he had healed of hepatitis C, autoimmune hepatitis, and I met them online. One was in Texas, one was in California, and one was in Oklahoma. And I got them all together, and I asked what was the protocol, and I put it together with the diet and the vitamins, and she healed in 4 months. So when I say Dr. Berkson has the protocol, I mean he reverses lots of different autoimmune diseases with IV of alpha-lipoic, low-dose naltrexone. He has been doing this since 1979.
77.
I have typographical error in my book. So, please, without further ado, welcome Dr. Burt Berkson.
Thank you very much for inviting me. I really like New Jersey. One of my first jobs was a professor at Rutgers in 1968. And my daughter was born about 10 miles from here in Livingston, New Jersey, at St. Barnabas Hospital. So I have nice thoughts about this state. Well, you can't hear me back there? Okay.
Maybe bring it up closer. You want to move it up that way? We could do that too. If we could do this wireless, we can move this towards the back. Yeah, that's that. I don't want to get confused by going higher or Michael.
Can you guys hear me now in the back? Yes, okay. All right. Well, first of all, I'm probably a very different type of a doctor, an MD. I started medical school in Chicago right out of college and very young, immature. And I used to ask questions all the time. They always told me to be quiet. And one day the professor came up to me and he said, "You know, we don't ask questions in medicine. We give you information, you memorize it, you give it back to us just the way we give it to you, then you're an MD." And you know, this sort of bothered me even as a young man. And I didn't like having to wear a tie every day. In those years, you had to wear a tie, and you had to get it. I was always getting on the elevator before the chiefs, and that always upset them. And I quit. And I went to graduate school at the University of Illinois, got a master's degree, a PhD in an area of cell biology and microbiology. And I became a professor at Rutgers University. And then many things happened. I remember I had relatives in Chicago who were having problems with doctors, and I'd call them up. They never had time to talk. And I thought, well, maybe I'll pick up an MD as a sideline and never practice, but have a lot more power at the universities and a lot more money. And I eventually ended up in Cleveland at one of the Case Western Reserve medical schools, and finished up there and went into their internal medicine program. And I was there for a very short time when I started driving everybody crazy, and they were driving me crazy. The chief of medicine came up to me one day and said, "I'm really upset with you. You don't have any deaths on your service. You'll never win the Black Crow Award." And I said, "Well, aren't I supposed to keep people alive?" He said, "In these big institutions, you get to practice a lot, and every once in a while you kill somebody. Everybody's seen several deaths, and you've seen zero. I've never seen this before. So we're going to give you 2 people who will surely die. They ate poisonous mushrooms. They'll be dead in 2 weeks. Go upstairs, watch them die, take notes, and present it to Grand Medical Rounds in 2 weeks when they die." So how do you know they're going to die in 2 weeks? "Well, our experts said so." "You don't trust experts?" "No." "Well, what kind of a person are you?" So, "Well, I only expect to do a year or 2 of this residency, and I expect to go back to a professorship." He says, "Take my word for it, they'll be dead in 2 weeks. They ate poisonous mushrooms, and this is the worst thing that could happen to a liver. No one can survive this without a transplant." So I went upstairs, this is 1977, and looked at these 2 sick people. And as a good doctor, I should have sat down, take notes, watch them die. But as a scientist, I called Washington, D.C., spoke to the head of our National Institutes of Health, Dr. Fred Barter, and I asked him, "Is there anything in the world that'll regrow a liver?" He said he was studying alpha-lipoic acid as the wonder drug for the reversal of diabetes and diabetic neuropathies and retinopathies. He said, but when they give it to people with diabetes, they seem to regrow their organs. It stimulates stem cells to regenerate tissues. He sent me 2 cases, picked it up at the airport, ran back to the hospital, and checked into the 2 people. Within 2 weeks, they regrew their livers. And I suspect they're in their late 80s now, still with no liver damage. Dr. Barter from Washington was so impressed. He came out with a group from Washington, from the National Institutes of Health, to set up a national conference in Cleveland on organ regeneration, asked me to be the lead speaker. The chiefs were really angry. They said, we told the families they'd be dead in 2 weeks, they're alive and well, you made us look like fools. And you used a drug that wasn't on our formulary. I said, well, the formulary committee doesn't meet for a month. He said, probably I would have been fired on that day, but Dr. Barter and the National Institutes of Health took me under their wing. And we gave it to 79 people with end-stage liver disease waiting for transplants and couldn't get them. And within, I'd say a month, 75 out of 79 regrew their livers. Now, you would think this would be accepted right away and people would get all excited about it. Out of the most prestigious place in the world, National Institutes of Health, out of Case Western Reserve University, the Cleveland Clinic Hospitals. I wrote a short note for the New England Journal of Medicine. It was published. And every time I saw a liver doctor, they said, you're not a liver doctor. You have no right to do this. Stay out of our business. You want to know what I did? No. We have no interest in what you're doing. Then Dr. Barter and I were invited to be visiting scientists in Germany. We went over there. It became a big drug over there. He and I wrote 3 publications that were published in big symposium journals. When I got back to Cleveland, I was told, you can't talk about this anymore in Cleveland. I said, why? So whenever you see a big institution with maybe 15 blocks of hospitals, hotels, restaurants, thousands of employees, we don't support this by regrowing livers. If we regrow the liver, we lose a patient. If we transplant the liver, we make $500,000 in 2 weeks. We have a short leash on them for the rest of their lives. So you're a professor. You're not a doctor as far as we're concerned. Teach our students about germs. That's what you're an expert in. You have anything you want. Continue saying people can regrow an organ without a transplant will destroy your career. And you know, I grew up on the streets of Chicago, and I didn't let these guys scare me. And I kept doing what I was doing anyway. Then I got a call from one of the big institutions. I won't name it. I can tell you personally later on. The head of medicine there called me up and said, "Do you think it would work for the reversal of diabetes and diabetic neuropathies?" He said, "We have 1,500 people here, no, 1,200 people here waiting to have their toes amputated. Think it would work for this?" So yeah, I think it would. So I sent him, I think it was 100 cases. I was the Food and Drug Administration chief scientist for this as a prescription drug by that time. And then a few years later, I read this article that this group had taken 1,200 people, waiting to have their toes amputated, gave nothing but intravenous lipoic acid. Within 3 weeks, they grew new blood vessels, new nerves in the toes, and did not require amputation. So I thought, well, finally, it's going to become a prescription drug. They stopped doing it. So I called a drug company. I told them I was the Food and Drug Administration chief person for this. Why did they stop? And the vice president looked at me and said, or told me over the phone, he says, "You know, off the record, he said, this is a big place. If they regrow the toes, they lose the patient. If they cut them off, they make a lot of money. They come back next year, have a foot amputated, then a lower leg, then an upper limb, then the other side. Your drug's bad for their business. That's why they stopped." So I said, "Well, they had such great results. Are you going to put it on the market as a prescription drug?" And he said, "Look, we basically want one drug for one indication. Your drug is too good. If we give it for diabetic neuropathies and retinopathies, it also very effectively lowers blood sugar. So we lose our money on our insulin products. It changes cancer metabolism from anaerobic, or without oxygen, to aerobic. Cancer cells die from this. We lose money on our chemotherapy. It gets in the heart and chelates the calcium in the coronary arteries. We lose money on our heart drugs. It regrows the liver and lungs. This is the most horrible drug that has ever been around. It'll never get on the market." And then a few weeks later, I got this letter from the Food and Drug Administration saying, "You were fired. You're no longer the chief investigator." So anyway, I got so fed up with university work, I became a country doctor, not far from Lubbock, Texas. My kids thought we were cowboys and cowgirls. Then a job opened up in the El Paso area with William Bowman Army Hospital and McAfee Hospital near Las Cruces, and I took that job. And then about 20-some years ago, I decided I was going to open a little office, do what I think is right, not fight with people anymore. And we have people from all over the world coming in, all word of mouth. Right after I opened up, a man walked in with a walker, could hardly even move. He said MD Anderson told him he had only a few weeks to live. He had prostate cancer in his bones. He had rheumatoid arthritis and systemic lupus. I said, "What could I do for you?" He said, "Well, can you give me pain pills?" He wanted to put his wife in a home before he died. I said, "Sure." Then he asked me if I ever heard of Dr. Beharry in New York. I said, "No." He said he heard Dr. Beharry was stopping the growth of cancer and curing rheumatoid disease, autoimmune disease. So I said, "Why don't you go up there and see him?" He says, "Well, he's just in a little office in New York. If he's any good, wouldn't he be at Sloan Kettering or Dana-Farber?" I said, "If he could cure cancer, he'd probably put him out of business. They treat cancer, they don't cure a lot of cancers." And I told him how they wanted to kill me in Cleveland because I was regrowing livers rather than transplanting them. He went up and saw Dr. Beharry. And about 3 years later, he walks in without his walker. I thought he died. He said, but here he stopped the growth of the cancer, stopped the rheumatoid disease with a drug that costs $20 a month, low-dose naltrexone. And I was very skeptical. I gave it to a lot of people with lupus, MS, dermatomyositis, rheumatoid arthritis, and the majority of people got better right away. And next slide, please. This is where I live, Las Cruces, New Mexico. It's north of El Paso, Texas. It's in the desert, and there's some beautiful mountains close by. They're about 8 miles from our house. This is a view from our front window. They're called the Oregon Mountains, and there are all kinds of interesting wildlife there. Next slide, please. These are the mushrooms that the people ate in Cleveland. They're Amanita phalloides or Amanita verna type mushrooms. One bite will kill a person. Next slide. Picking mushrooms could be like playing Russian roulette. Next slide. This is from the newspaper in Plain Dealer. One of my patients who was, he picked the wrong mushroom and was very sick, and we brought him back to health. Next slide. Alpha-lipoic acid for acute hepatic necrosis. That's what it was. Acute liver death, rapid liver cell death. 79 people terminal liver disease, 75 regenerated livers with just the administration of alpha-lipoic acid. I was appointed the Food and Drug Administration Chief Investigator. Next slide. This is a picture of Dr. Barter on the right. Let me get my pointer out. This is Dr. Fred Barter, who was Chief of Medicine, National Institutes of Health. And that's myself and Dr. Barry Rumack, who was Professor of Medicine, University of Colorado. And this is when we were visiting scientists at the Max Planck Institute in Germany. Next slide. Well, what did my medical colleagues in Cleveland think about my research? They were very angry with me. Next slide. Lipoic acid is a very simple molecule. It's octanoic acid, 8 carbons with an acid group at one end and sulfurs at the other end. Next slide. And lipoic acid does many things. I don't know how many people realize that the reason we're alive is because of alpha-lipoic acid. Did you know that? Look, every cell of your body is making it right now in small amounts. It turns your food into energy in the mitochondrion of the cell. This is the main thing it does. And if you talk to your doctor or some scientist or something, they say, never heard of it? My God, I used to teach this 50 times to medical students and graduate students. Everyone should remember this. This is the reason we're alive. It changes our food into energy. It also is a great free radical scavenger. It modifies gene expression. In Russia, when somebody, in parts of Russia, if somebody has a myocardial infarction, a heart attack, they give them intravenous alpha-lipoic acid and it reverses it immediately. They don't want to hear about this in the United States. It makes insulin more effective. It stimulates immunity. It gets rid of heavy metals. It stimulates organ regeneration. It's the greatest glutathione generator in the body. It does lots of very important things. And people often say if something does too many, has too many actions, it can't be any good. if it was made by nature, if it was made by God, if it was given to us, these types of agents are what keeps us alive. Next slide, please. Some of the things that alpha-lipoic acid does in our body. Next slide. See these little organelles, these little structures? These are mitochondria. In every cell of our body, we have these mitochondria, and they convert your food into energy that keeps us alive. That's where the lipoic acid works, one of the places it works. This is with the oxygen. Next slide. And this is actually chemically what it does. It converts, during this process of glycolysis, sugar is converted into something called pyruvate. And this is where this pyruvate is burnt to produce energy to keep us alive. Lipoic acid is the key to this. It turns this into this. Now, cancer cells just do this. Did you know that? Cancer cells don't require a mitochondrion. Their mitochondria are defective. Regular healthy cells need a good functional mitochondrion. Next slide. So food is converted into pyruvate. Cancer cells just go that far. They actually turn this into something called lactate. This is where energy is produced. The key from this to this is alpha-lipoic acid. Next slide. So lipoic acid forces anaerobic metabolism into aerobic metabolism, which is normal metabolism in humans and mammals. Next slide. So lipoic acid is the fundamental regulator of oxygen metabolism in plants, animals, fungi, and several bacteria. Next slide. Without lipoic acid, all air-breathing organisms would be dead. Next slide. Since a young person produces tremendous amounts of alpha-lipoic acid, what if you give him a Thanksgiving meal? What's he going to be doing? He'll be climbing the walls, running around the house. He's converting this food into energy. What if you give it to an 80-year-old man? He'll be sleeping on the couch, won't he? Unless you give him alpha-lipoic acid, he'll be walking around the house then. Next slide. Yeah, there's the 80-year-old guy. Next slide. Well, what if a mitochondrion receives too much alpha-lipoic acid? Well, it starts revving up faster and faster and faster, heating up, and then guess what? It blows up. Dr. Couch, Dr. V. Hill, and some others did a study of what it would take to kill a primate with alpha-lipoic acid. I was asked to be part of this study, but it was done with monkeys, and I like monkeys better than some people, so I wouldn't do it. Next slide. Following these studies, I was asked to observe the autopsies of these monkeys and perform the electron microscopy work on the damaged tissues at New Mexico State University. After these monkeys received too much alpha-lipoic acid, tremendous amounts, there were actually dead areas in the liver and the kidneys and the heart and the large muscles of the legs and arms. Next slide, please. Here's a normal mitochondrion. And you can see these membranes, really beautiful. These are the mitochondria after too much lipoic acid, tremendous amounts. So lipoic acid in very, very high doses can be very toxic. But water is very toxic in very high doses. Salt is very toxic. It takes about 100 milligrams per kilogram to kill a person with alpha-lipoic acid, which is tremendous amounts intravenously. Next slide. So we published this in one of the big journals. Dr. Vigil, myself, Dr. Garcia from Emory University. A liver mitochondria suffered severe structural damage in extremely high doses of alpha-lipoic acid. Next slide. If lipoic acid worked for acute liver disease, would it be effective for chronic liver disease, like autoimmune hepatitis, hepatitis C, cirrhosis of the liver, primary biliary cholangitis, progressive sclerosing cholangitis? Next slide. This is what we hate to see, a cirrhotic liver. Next, please. Here's one of our patients. Came in a few years ago, end-stage liver disease. Here's the guy. He had his belly's filled with fluid, very, very sick. His mother actually dragged him in. He didn't want to go. They told him he'd have a few weeks to live without a transplant. We put him on our program. This is 2 years later, completely regrew his liver, no sign of liver disease. Next slide. And they say that's impossible. Hepatitis C. I developed the triple antioxidant therapy for hepatitis C in Germany in 1999. Next slide. And we use alpha-lipoic acid, 300 milligrams twice a day to regenerate the healthy liver cells that were left. Oral selenium. Selenium is a birth control pill for many viruses. When selenium levels go up into a certain point, viruses have trouble replicating. And silymarin, which protects the liver from further damage. And if they're really sick, we give them IV lipoic acid. Next slide. This is an electron micrograph of a person with hepatitis C, and these are the hepatitis C viruses within the cell. You know what that thing is? It's a mitochondrion. Next slide. Okay, alpha-lipoic acid stimulates healthy stem cells to regenerate vigorous new tissue. Next slide, please. What are the most important laboratory tests for liver disease? The platelet count, the albumin, the time it takes your blood to clot, and last, which a lot of doctors think are most important, is the liver enzymes. The platelet count, if the platelet count goes down, if the liver is damaged, there's back pressure in this blood vessel called the portal vein. And the spleen is also attached to this. So the spleen swells up like a balloon, like a water balloon, and platelets get caught in it. So people with liver disease have low platelet counts. The albumin is probably the most important test for the liver. A sick liver cannot have a high albumin. Sick livers have low albumins. The prothrombin time, the time it takes your blood to clot, is very important because the liver makes the clotting factors. And the ALT just shows liver damage. But you know, the sickest livers, the cirrhotic livers, have low liver enzymes. You know why? Because there's very little liver left to break down. Next, please. A typical patient, 40-year-old woman, Mrs. KV, developed hepatitis C from a blood transfusion. The liver expert said she is seriously ill and must be treated. Next slide. We put her on our triple antioxidant therapy. Next, please. Her platelet count went from that to that, from about 140,000 up to around 300,000. Next. Her albumin level went from, let's see, 4.2 to 5 something. Next slide. Her liver enzymes went from more than 300 down to normal. Next. And her prothrombin time went from 14, which is high normal, to completely normal. Next slide. So my regimen for serious liver disease is triple antioxidant therapy plus low-dose naltrexone, intravenous LIPOIC, a diet program of supplements, exercise, sleeps, adequate sunlight, avoidance of alcohol, use of prescription drugs if necessary. Next slide. And I published this in a very prestigious journal, the German Journal of Internal Medicine, a conservative triple antioxidant approach to the treatment of hepatitis C. I took 3 cirrhotic hepatitis C patients in the process of liver transplantation evaluation at university hospitals, administered my program, and 3 recovered within 6 months. Next slide. This is what I quoted at the end of the article. It appears reasonable that prior to liver transplant surgery evaluation or during the transplant evaluation process that my program should be considered. If there's significant betterment in the patient's condition, liver transplant surgery may be avoided. And this really pissed off the liver community. I mean, they don't want to regrow livers. They want to cut them out and transplant them. That's where the money is. Next slide. Low-dose naltrexone. What does it do? Well, it reduces inflammation. It has many other actions too. There's a drug in Israel called medenkephalin. I think it's about $4,000 an injection. It's an anti-cancer drug. If you take low-dose naltrexone at bedtime for $20 a month, in the morning your nervous tissue produces medenkephalin, which binds the cancer cells and kills them. So for $20 a month, you make your own $4,000 a month drug. Next slide. So low-dose naltrexone fools the brain. Not enough endogenous opiates in the bloodstream. In the morning, you get a flood of endogenous opiates. At least one of them, medenkephalin, binds the cancer cells and promotes cell suicide, apoptosis. Others downregulate inflammatory markers. And as a result of this, many autoimmune diseases disappear. The original work was done by Ian Zagan at the Penn State University. And then Dr. Bahari in New York picked this up and used it with people. Next slide. Autoimmune hepatitis. These people usually have a high anti-nuclear antibody. At one time, autoimmune hepatitis was called lupus hepatitis. It's really a type of lupus attacking the liver. Sometimes they have smooth muscle antibodies elevated, or liver kidney microsomal type 1 antibody 2. Next, please. Well, we use the same program for autoimmune hepatitis, and it seems to work. Next, please. In most people, here we have a lady with autoimmune hepatitis. When she came in 2005, her platelet count was 79,000. It should be over 130,000. And 2 years later, it was close to 100,000, which is pretty good. Her albumin was really low, 2.5. In 2007, it was normal. Her liver enzymes are very high, then it became normal. And her clotting time became normal. Her ANA went from 80 to 0. Next slide. Here's another, oh, this is the same lady. Just shows how the ANA went down. Next slide. Here we have another woman with autoimmune hepatitis. Her, in 2010, her platelets were 95,000. By April 2017, it was 115,000. You can see she did very well. Next slide. Same thing. Her ANA went from 150 down to 0. Next slide. Same thing. Next. What about low-dose naltrexone and lipoic acid for systemic lupus and rheumatoid arthritis? Next slide. This is something that we're preparing for publication. You can see with systemic lupus, these are the kind of results we have with individual people. Rheumatoid arthritis too. Tremendously good results. Very simple. And like I say, most conventional medical people don't want to hear about this. It's too simple, too inexpensive. People don't make a lot of money on it. It just helps patients. Next slide. Are there other diseases that lipoic acid might help? Well, lipoic acid is a potential therapy for any chronic disease associated with oxidative stress. Most diseases are associated with oxidative stress. Next slide. Oxidative stress in the mammalian heart is reversed by alpha-lipoic acid. People have a heart attack, they give them intravenous lipoic acid right afterwards, it reverses the whole process. Then people wouldn't have to stay in the hospitals lose a lot of money. Next slide. What about lipoic acid and diabetes? Henriksen published the first human study to show that lipoic increases insulin-stimulated glucose movement into the cell. In other words, it reverses diabetes. Next slide. This study demonstrated that lipoic acid is an effective treatment for diabetic neuropathies and also neuropathies of the cranial nerves, leading to full recovery of patients. We do this every day in Las Cruces. Next slide. What about lipoic acid and cancer? By the way, you know, this doesn't work all the time, but it works the majority of the time. All hallmarks of cancer can be linked to impaired respiration and energy metabolism. Dr. Warburg wrote about this in 1928. He won a Nobel Prize for this, by the way. And I remember several months ago, I was at a conference from MD Anderson Cancer Hospital. And I walked up to the booth where they had a booth. And this young oncologist woman hands me a tray full of candy. Mars bars, Three Musketeers, Hershey bars. And I said, I can't imagine a oncologist handing out candy. She said, why? I said, because cancer grows in sugar and iron. And you want to starve the cancer. She said, well, that's not true. I said, what do you mean it's not true? Warburg proved this in 1928 with his studies. So I never heard of Warburg. I said, have you ever heard of a PET scan? Yes. But why don't you tell me what it is? Well, they take sugar and inject it in. Oh my God, I never even thought of that. Could you believe this? I mean, that's how, you know, most specialists, doctors see things like this. They just can't see anything outside of what they do. So anyway, Warburg found out that was true. Next slide. This is a normal cell with mitochondria and a big nucleus. Next slide. This is a breast cancer cell. The mitochondria, as you can see, are all dried up. They're not functional. Cancer cells don't need mitochondria. They don't need oxygen to grow. They just do the glycolytic pathway. Next slide. Alpha-lipoic acid stimulates apoptosis, which is cell suicide, in human breast cancer cells. Published in 2009. Alpha-lipoic acid induces cell suicide or death of lung cancer cells. Next slide. At our clinic, we give intravenous lipoic acid for cancer, intravenous vitamin C, hydroxycitrate or hydroxycitrate, various supplements such as artemisinin. You know, somebody won a Nobel Prize for artemisinin a couple of years ago. Most people have never even heard of it. It's an anti-parasite drug or agent, but it also is very poisonous to cancer cells. And we use various prescription drugs like metformin, which keeps cancer cells from getting too much sugar. Aprazolam, which is Xanax. Most people with cancer are nervous, so we relax them a little bit. Cimetidine, which stimulates killer cells to kill cancer. And mebendazole, mebendazole used to be like $4 a month as an anti-parasite medication. But then, when somebody discovered that it also kills cancer cells, they sort of took it off the market. And you can get it through compounding pharmacies now. Now it's like $100 a month. But I wrote a prescription for somebody, and rather than going to a compounding pharmacy, they went to Walgreens or Walmart, and it was $22,000 a month. Since they found out it kills cancer. They didn't purchase it there. They went to the compounding pharmacy. But it's really interesting. When something is found to be effective, its price goes up tremendously. Next slide. I wrote a paper on the low dose, on the long-term survival of a patient with pancreatic cancer, stage 4. In 2006, we published the first human study that demonstrated the therapeutic effects of lipoic acid combined with low-dose naltrexone for cancer. Next slide. Here's a lady, a nurse, who developed hepatitis C from a finger stick. And then she developed hepatitis C, and then it went on to hepatocellular carcinoma, liver cancer. Next slide. This is a PET scan. You can see in the liver, every light-colored thing is a cancer. Her liver was just filled with cancer. She went to the university. They said nothing could be done. She'd be dead in a few months. Go to hospice. She came to our office. Next slide. This is 28 months later, no sign of cancer in the liver. Next slide. Here's a person with kidney cancer in the left kidney. A patient, I think he was at Baylor University Medical School. Next slide. And they took out the kidney, but they discovered a gigantic metastasis to the lungs. And they tried everything, nothing worked. His wife had to carry him into the office. He could hardly even walk. This is in 2010. Next slide. We started treating him. We started feeling better right away. But every time we did a PET scan or a CAT scan, the tumor was still in the lungs. And all of a sudden, in 2014, it disappeared. Next slide. And we published this long-term survival of a patient with stage 4 renal cell carcinoma in one of the big cancer journals. All of this stuff is published. So anybody tells you nobody's ever done any work on these things, they haven't looked at the literature. Next slide. Then we published another paper on 3 more people with stage 4 pancreatic cancer. Within 6 months, the PET scan showed no cancer. Next, please. And the reversal of a B-cell lymphoma that was considered terminal. I think he was a policeman from Chicago. Next slide. This is that fellow. Great big tumors in his neck and his groin. These are the kidneys getting rid of the dye. Next slide. Within 6 months, no sign of cancer in his groin or under his arms. Next one. So I was very surprised when one day I got a call from our National Cancer Institute in Washington. Dr. Abrams, who's one of the chiefs over there, said, I've been looking at your work in the medical literature, and you're getting better results in some of the big cancer hospitals. Can we invite you to Washington and teach us what you're doing? And I said, sure. And I thought they'd really argue with me there. The National Cancer Institute is the most prestigious place in the world for cancer. So I went. My daughter, who's a lawyer, says, you better bring a gun with you. They might try to kill you. I said, you can't bring a gun to Washington. So, so anyway, I went there and spoke for an hour, and they didn't argue. They all stood up and applauded. And then a fellow walked up to me from one of the big Ivy League schools. He says, I'm head of oncology there. He said, I've been following your work for years, and I flew down just to meet you from New England. And he says, well, very nice meeting you. What can I do for you? He said, I have an aunt with breast cancer. How should I treat her? I said, what do you do at your institution? I could tell you the institution later, but I don't want it on record. He said, I'm a board-certified oncologist. All I could do is chemotherapy. Everybody does the same thing. Nobody gets in trouble. But I never do it for my own family. Can you believe this? And then Dr. Abrams came up to me and said, this is amazing stuff. It's a metabolic reversal of cancer. He said, but don't get your hopes up. He said the drug companies would never allow this to be on the market unless we have a Great Depression. Then, people won't be able to afford that kind of stuff. So a few years later, he calls me up, and he says, I think we're going to have a Great Depression. He said, I think this guy Obama is spending so much money that we're gonna go down the toilet. And then if Hillary gets in, it's going to get even worse. He said, we'd like to invite you back. He said, we'll give you a whole afternoon to speak. Present 7 cases of terminal cancers that you've reversed at your clinic. And we'll have our expert oncologists discuss each case. So I went there and spoke for a whole afternoon. And their experts went over each case. And they said, hey, this is all valid. And they wrote this big newsletter up from the National Cancer Institute and sent it to all the oncologists in America, which just really got them angry. They said, he's not even an oncologist. Why would you invite a non-oncologist? Why didn't you invite me? But you do the same thing everybody else does. You don't do anything different. Next slide, please. So this is what they said. They said the cases presented by myself were submitted and given rigorous scientific evaluation by National Cancer Institute oncologists. The ultimate goal is to identify these innovative medical interventions that might be effective. Dr. Berkson reported the combination of LDN and ALA, along with other things, that cause several cancers to go dormant. Early in his medical career, he published papers repairing liver damage from mushroom poisoning and chronic infections. He also cited a number of research articles. Yeah, I'm almost finished. Okay, next slide. Everywhere else in the world are interested in this. In Japan, And this is from when I was in Scotland. Next slide. Well, lipoic acid, summary, is necessary for all oxygen-breathing organisms, rate-limiting factor for the production of energy from our cells. It forces anaerobic metabolism to aerobic. It does many other things. Next slide. Most pharmaceutical drugs do not address the cause of the disease. They address the symptoms. Lipoic acid gets to where the rubber meets the road and turns it around. Next slide. Most of our patients that I see have hepatitis C, autoimmune hepatitis, diabetes, autoimmune disease. You know, we're not seeing cancer people from out of town anymore because sometimes, you know, they come in after they're completely almost dead, and there's really not much you could do for them. They've gone through the whole system. They could hardly, and they go sour when they're in Las Cruces. So we only see people that are fairly local. Next slide. But we see liver disease people from all over. So some of the books that describe my therapies, my favorite book is Lipoic Acid Breakthrough. I really should write another one. Syndrome X was a national bestseller. Honest Medicine, I wrote 2 chapters in it. My first patient with reversal of pancreatic cancer wrote a chapter, and my liver cancer person wrote a chapter, and, you know, Curing Courtney. Next slide. Then I wrote 2 more books too. Thank you. It was fun.
I know you want to eat more, but if there's any burning questions, please ask now. Go.
Okay.
Personally or out
No,
loud?
go ask them now, right now.
Okay.
You know, what's your first, no,
No, out loud.
sit down, out loud.
No, she's looking for volunteers.
Okay.
What's your question?
It's personal.
Oh,
I don't
okay.
share.
Yes, ma'am.
Um,
Speak real loud.
Mitochondria, from what I understand from biology 101, is an engulfed bacteria. And so many people have think that they're treating themselves with eating fermented foods, like any.
I know what you're saying. What she's saying is that what are high-level mammalian cells? They have mitochondria in it. They have several other organelles. Well, what's the origin of this mitochondrion? Biologists say they were ultimately free-living bacteria who attacked the early cells and got along so well in them and produced so much energy that it became incorporated in higher type cells. Is that what you were asking?
Yeah, so eating fermented foods and that sort of thing can be helpful. Does that not?
Well, it depends the kind of fermented food. You know, a lot of these fermented foods are full of toxins, you know. And they sell them in health food stores and people love them. They make people sick.
Okay, you know what? We do have a lot of questions. I want to ask you to ask him in the corridor because we want to bring up in 15 minutes, we're going to bring up Diane Freeman, but I know that you're going to want to talk to him. So please, it's a good time to take your question and ask him personally. There's so many. There's so many